For more than 40 years, ophthalmologists have given older adults the same advice for failing vision after 60. Use the drops, take the multivitamin, hope for the best. But what if some of the most promising recent research on age-related macular degeneration involves no drops, no prescription, no pharmacy at all? There is one tiny seed, and I do mean one, that newer clinical trials suggest helps the macula in ways no eye drop ever has. Your doctor has probably never mentioned it. By the end of this video, you will know exactly what it is, why it works, and the precise daily protocol to start on. I'm Dr. Richard James. I've spent more than 30 years helping older adults protect what most of them admit is the sense they fear losing most, their sight. In the next 18 minutes, I'm going to walk you through why eye drops were never built to repair age-related macular damage, the one seed the research is starting to pay serious attention to, and the exact daily protocol I would put my own mother on starting tonight. Here is some context that changes the whole conversation. Roughly 20 million Americans aged 40 and older are living with some stage of age-related macular degeneration. About 1.5 million have the advanced vision-threatening form. The macula is the small, central patch of your retina that handles your sharpest vision, the part you use to recognize a grandchild's face, read a prescription label, or drive home safely after dark. It degrades when oxidative stress overwhelms the retina's natural antioxidant defenses. Here is the central misconception you need to understand. Eye drops, by their design, sit on the surface of the eye. They cannot cross what's called the blood-retinal barrier, the microscopic wall that protects the back of your eye where macular damage actually happens. The drops in your medicine cabinet are quietly doing far less than you've been led to believe. The question isn't whether the drops are bad. The question is why so many of you were ever allowed to believe the drops alone were enough. Stay with me, because I'm going to give you the exact dose, the exact form, and the exact timing. The protocol I would put my own mother on starting tomorrow. Here is something that does not get said in a 6-minute eye exam. The macula sits at the very back of your retina. It is protected by the blood-retinal barrier, a microscopic wall designed to keep most things out of the most sensitive tissue in your visual system. A drop applied to the front of your eye has approximately the same chance of repairing your macula as a hand cream has of healing a broken rib. The drop is in the wrong place to do the job. Most prescription eye drops were built for a different problem entirely. They lower pressure in glaucoma. They thin the tears in dry eye. They calm inflammation in irritated conjunctiva. None of those mechanisms address the slow, oxidative damage that drives age-related macular degeneration. Yet I see patients every week who walk into my office holding a bottle of drops they have used faithfully for years, convinced those drops have been working on their retina the entire time. This is the part that frustrates me the most as a doctor. The drops are not the problem. The problem is that we let an entire generation of older adults believe the drops were the answer. Picture a representative patient I see the equivalent of in clinic almost every week. A retired school teacher in her early 70s. She has used her prescription drops faithfully every morning and every night for 6 years. She follows every instruction her ophthalmologist gives her. She reads the labels. She refills on time. At her annual imaging, the dry AMD she was diagnosed with at 67 has quietly progressed toward the wet form anyway. She is not failing the protocol. The protocol was failing her, because the protocol was never targeting the cells where the damage was happening. So, what is actually happening at the cellular level? Inside your retina sits a delicate layer of cells called the retinal pigment epithelium. Those cells are the housekeepers of your vision. Every day, they clear out the metabolic waste produced by your photoreceptors. As you age, that housekeeping gets sloppier. Waste accumulates. A pigment called lipofuscin builds up. The supporting layer thins. Oxidative stress overtakes the antioxidants your body once produced in abundance. Your macula is being eroded from inside, in slow motion, while the drops you have been prescribed sit on the wrong side of a wall they cannot cross. Here is what the leading antioxidant research has been pointing toward for over a decade. The Age-Related Eye Disease Study 2, sponsored by the National Eye Institute, followed thousands of patients and confirmed that a specific blend of antioxidant nutrients can slow the progression of intermediate AMD to its advanced form. The takeaway from AREDS2 was not, take more drops. It was that the right nutrients, delivered systemically through your bloodstream, can change the trajectory of this disease. That single finding is the door through which everything I'm about to tell you walks. So now you know the drops were never going to fix this. The obvious next question is, what does? The answer is something that, until the past few years, almost nobody outside a small group of researchers was even paying attention to. Saffron. Specifically, the deep red threads of Crocus sativus, the same spice that has been used in cooking for thousands of years. I will be honest with you. I dismissed this for years. The idea that a cooking spice could meaningfully change a stubborn retinal disease sounded to me like every other internet vision claim I have learned to ignore. Then, the trials kept coming. Saffron contains a compound called crocin, and crocin is one of the most studied carotenoid antioxidants in the recent retinal research literature. In a randomized, double-blind, placebo-controlled trial led by Dr. Benedetto Falsini and his team in Rome, 25 patients with early AMD received 20 milligrams of saffron per day for 3 months, then switched to placebo for another 3 months, or vice versa. The measurement the researchers used was something called retinal flicker sensitivity, a precise, objective signal of how well the macula is firing. The saffron group showed a statistically significant improvement compared to placebo, not just stability, but measurable improvement in central retinal function. Falsini's group followed those patients longer in a 2012 follow-up published in Evidence-Based Complementary and Alternative Medicine, and the benefit held up over more than a year of continued supplementation. A 2024 review on Crocus sativus and AMD summarized the broader literature. Daily supplementation of 20 to 50 milligrams of saffron, or 5 to 15 milligrams of pure crocin, for periods of 3 to 12 months, has been associated with measurable improvements in visual acuity, contrast sensitivity, and electroretinogram readings in both the dry and wet forms of AMD. These are not blog claims. These are peer-reviewed clinical findings. Then there's the Chia conversation. Chia is not a treatment for macular degeneration on its own. Let me be clear about that. But its alpha-linolenic acid profile and its broader antioxidant load make it one of the cleanest companion foods you can pair with saffron. Alpha-linolenic acid is an omega-3 fatty acid that supports the lipid integrity of retinal cell membranes, the same membranes that lipofuscin buildup is degrading. So while the saffron is reaching the back of your eye through your bloodstream, the chia is helping reinforce the structural envelope of the cells the saffron is trying to protect. I know what some of you are thinking. A spice and a seed. That cannot possibly do more than a prescription medication. I understand that reaction. I had it myself. Let me walk you through exactly why this stops being surprising the moment you understand the mechanism. Stay with me, because the next few minutes are the most important thing I will say in this entire video. This is where the science takes a turn that, in my experience, changes how people think about food for the rest of their lives. Here is what crocin appears to do, in plain language. Crocin travels through your bloodstream, not topically, but systemically. It reaches the back of the retina, where eye drops physically cannot. Once it gets there, it does at least 2 important things. First, it acts as an antioxidant inside the retinal pigment epithelium, the housekeeping cells we talked about earlier. Crocin neutralizes the same oxidative compounds that have been quietly tearing apart your photoreceptors and accelerating the lipofuscin buildup. It helps the housekeepers do their jobs again. Second, the research suggests crocin may modestly improve blood flow to the choroid, the deep layer of tiny vessels that feeds the retina its oxygen and nutrients. Better blood flow means better nutrient delivery. Better nutrient delivery means the retinal cells you have left are working with fuel they have not had in years. Chia plays a supporting role at the membrane level. Each retinal cell sits inside a fatty envelope that has to stay flexible to function. As that envelope hardens with age, the cell becomes less responsive. The alpha-linolenic acid from chia helps replenish the omega-3 fatty acids your body uses to rebuild these membranes. It is not a quick fix. It is structural maintenance, done one meal at a time. This is why food works where the drops failed. Drops sit on the surface. Crocin and the antioxidants in Chia travel inside you. They reach the place that is actually breaking. I want to be honest about the limits of all of this. The Saffron evidence is strong enough to take seriously. It is not yet strong enough to call definitive. The Falsini trials are small. The follow-up work is promising. The 2024 review is encouraging. None of it is the kind of large-scale randomized evidence we have for, say, the AREDS2 vitamins. So we are working with a research base that is suggestive and growing rather than closed. Here is the thing, though. The damage AMD does is not waiting for the perfect trial. Your macula is losing capacity right now, today, while you watch this video. The realistic question is not, can I wait for a 10,000-person trial before doing anything different? The realistic question is the evidence strong enough, the safety profile clean enough, and the cost low enough that adding this is reasonable while we wait for that bigger trial? On those three questions, the Saffron and Chia case is one of the better ones I have seen in recent decades. So you understand the problem, you know the answer, you know why it works. The only thing left is the most important question of all. What exactly do you do with this information starting tomorrow morning? I want to address something head-on first. Some of you are thinking, if Saffron is this promising, my ophthalmologist would have told me about it. I want to be honest with you about that. The doctors who didn't tell you about Saffron are not the villains in this story. Most ophthalmologists are extraordinary at what they were trained to do. Diagnose disease, perform surgery, manage intraocular pressure, prescribe drops. Most of them were not trained in nutritional research, and the strongest Saffron findings are recent enough that they have not yet propagated into routine clinical training. The disconnect is structural, not personal. Your eye doctor is working from a toolkit that has not yet caught up with the food research. Some of you are also thinking, saffron is expensive. That is true. Real saffron threads are one of the priciest spices in the world by weight. The dose used in the research, though, is small, roughly 20 milligrams per day, the amount that fits on the head of a small spoon. A high-quality jar of real saffron threads, used at that dose, lasts most people 6 to 12 months. Many seniors are already spending more on supplements with weaker evidence behind them. When you compare cost per day to almost any other supplement aisle bottle, the math is more reasonable than it looks. Now, the most important caveat of this entire video. If you are taking warfarin, a direct oral anticoagulant like apixaban or rivaroxaban, daily aspirin, or any other blood thinner, do not start a saffron protocol without your prescribing doctor's approval. Saffron has mild antiplatelet effects, and case reports have documented bleeding complications when patients on anticoagulants added saffron supplements on their own. That conversation has to happen first. This is not about replacing your eye doctor or your cardiologist. This is about adding information to the conversation you have with both of them at your next appointment. So here is exactly what I want you to do, starting tomorrow morning. Step 1. The saffron. A small pinch of real saffron threads, about 20 milligrams, which is roughly what fits on the head of a small spoon. Steep those threads in hot water for 5 to 10 minutes, like a tea. Drink the infusion once a day. Morning is best, but consistency matters more than timing. Real threads from a reputable source, not powdered saffron-flavored blends, not capsules of unverified extracts, the threads themselves. Step 2. The chia. 1 to 2 tablespoons of whole or ground chia seeds per day. You must soak them first, at least 10 minutes in water, in milk of your choice, or in a wet food like yogurt or oatmeal. This is not optional for older adults. Dry chia expands aggressively in fluid, and dry chia swallowed straight has been associated with esophageal obstruction events in adults. Soak them, always. Step 3. The supporting routine. If your ophthalmologist has placed you on prescription drops, do not stop them. This protocol is additive, not replacement. If you are on an AREDS2 style multivitamin, keep taking it. Keep your annual retinal imaging appointments. The point of saffron and chia is to reach the tissue your drops cannot, not to argue with the rest of your care plan. Step 4. The timing window. Give this protocol at least 90 days before you make any judgment about whether it is working. The retinal changes the research measures are not week-by-week phenomena. The patients in the Falsini work showed their measurable improvements at the 3-month mark. The patients in clinic who report changes in brightness, contrast, or text clarity typically report them somewhere between 8 and 12 weeks. If you stop after 4 weeks because you do not feel any different, you stopped before the research suggests improvement begins. Step 5. The safety call. Before your first cup, if you are on any anticoagulant, antiplatelet drug, or have any active bleeding disorder, call the doctor managing that medication. Tell them you are planning to start roughly 20 milligrams of saffron per day. Let them decide whether it is appropriate for you. Do not skip this step. If you do all 5 of those things consistently for 90 days, the saffron in the morning, the soaked chia daily, your existing care plan maintained, the safety conversation completed, you will have given your retina something the standard 6-minute appointment was never going to give you. You came into this video believing the drops in your medicine cabinet were doing more than they actually were. You are leaving it with a seed, a mechanism, and a protocol that the standard appointment was never going to hand you. The macula does not regenerate the way other tissues do. What you protect today is what you will be reading the birthday cards and recognizing the grandchild's face with 5 years from now. That is what is at stake, and that is why this matters. Subscribe, because next week I am walking through the broader carotenoid family for vision, the 2 food-based pigments that work synergistically with what we covered today, and where you actually find them on the shelf at the grocery store. You do not want to miss it. Share this video with someone you love who is over 60. You might be the reason they keep reading their grandchildren's birthday cards another 10 years. Take care of your eyes tonight. Soak the chia, find the saffron, and know that I'm rooting for every single one of you. I'm Dr. Richard James. I'll see you in the next one.